Funding for This Is Nashville comes from you, our listeners, and Music City Prep Clinic, Nashville-based provider for PrEP and offering comprehensive sexual health services in an environment designed to be safe, professional, and shame-free. Learn more at musiccityprep.org.
I'm Blake Farmer, and this is Nashville. If you could name one health commissioner in the history of the state of Tennessee, it's probably our guest for this episode. Dr. Lisa Piercey served as the state's top doctor during the COVID pandemic. She's a pediatrician by training, specializing in child abuse. Before serving the state, she was running hospitals in West Tennessee. Then there was the trial by COVID. But instead of returning to an old career or catapulting into a cozy corporate position, she took on a new challenge, raising money to buy companies that she thought she could make more valuable. And she's written a how-to book about it called Natural Born Entrepreneur. She's here to talk about that book and her life and career. Lisa Piercey, thanks for joining us.
Thanks for having me, Blake. Good to see you again.
You too. The title is Natural Born Entrepreneur of this book sitting in front of me. Are you saying you missed your calling or were a little late on it?
I was a slow learner for sure.
Really, though? I mean, you know, this book is really not so much of a personal story, but really about, like, here's how you do it. Here's how you consider raising capital to go buy a company. Here's what you look at. But your own story as an entrepreneur, did you really have these inklings, but just felt, I'm not on that track. I'm a pediatrician?
I did. And my whole life, from the very earliest memories, I watched my parents, my grandparents, my uncles, then ultimately my sister, start their own businesses, have their own entrepreneurial journey. And I was literally the first person in the family to work in corporate America. And I remember when I came out of, residency, I guess, and I told my dad about my first job, he used the phrase, "Oh, you're going to work for the man." And I'm like, "What man?" And it was kind of the first time I had heard that phraseology. And my family was supportive, but they didn't know what to do with that. And so just all along, I felt this pull to come back to entrepreneurship because that's how I was raised.
What kind of businesses were they in?
Oh, everything. So my dad is a farmer, comes from a long line of farmers.
And I guess any farmer, you're a small business is what you're running.
Absolutely.
Or a big business. But,
absolutely.
You know.
And also a little real estate in there, too.
Yeah. What did he grow?
Just grain crops, row crops, soybeans, corn, wheat. When I was young, he had a little bit of cotton. When I was very young, he had some hogs.
Really? But this is in West Tennessee?
It's in West Tennessee.
Is it Gibson County?
It's Gibson County, and then Obion County and several of the counties around it. But yeah, we've always grown up in Gibson County.
Wow. What other kind of businesses were in the fam?
So my mother started a children's clothing boutique in 1980 and then opened up a gift shop, with bridal registry and home decor next door to it in 1999. My grandparents had a department store that opened, I think, maybe in the 50s or early 60s. I still remember, I worked there as a teenager, so it was 30, 40 years in the making. And my sister started her own law firm. So everybody did that kind of thing. My great-grandfather had a gas station. It just goes on.
And this is all in that north of Jackson sort of area.
That's right, about 20, 25 minutes north of Jackson.
Okay. Well, you write as you open this book about kind of the moment when you're leaving the state after, kind of almost having an entire career over the span of just about 3 years, but during the COVID times. But you say, I was fortunate to have numerous opportunities to re-enter the private sector, some of them lucrative, high-profile roles that I once would have considered a dream, yet as I explored each option, I struggled to feel the expected excitement. The thought of stepping back into a large organization felt stifling. Realized that I truly wanted to carve my own path and embrace the entrepreneurial instincts that had always been in me. So, what is it that you were sort of looking for as you left this crazy COVID time?
I didn't really know what I was looking for. And it reminds me of a quote or just a piece of advice that my executive coach gave me when we were going through this. And he said, make sure you're running towards something and not just away from something else. Mm-hmm. And I didn't know what that towards was. I knew what I didn't want to do anymore, which was work in a very large corporate bureaucratic environment.
Yeah.
And it's not that there was anything wrong with it. I learned a ton. I had some great colleagues and good lessons, good experiences. But I didn't feel that I owned the risk-reward proposition.
What do you mean?
In a lot of corporate roles, you get rewarded for good performance, and I had some of those, and that was fine. But then I also realized if I don't show up next week, it doesn't really matter.
Wow.
Somebody else will come in, and if I take this risk and put my heart and soul into it, and it does really well, I'll get a pat on the back.
Yeah.
And so I just wanted more autonomy, more ability to bring that under my control. And it was never because I thought I had all the answers. It was because I wanted, it sounds cliche, I wanted to feel something.
Yeah.
I wanted to feel some risk. I wanted to feel some ownership when I did well. And there are pros and cons to that, and I was willing to take it.
Well, I was going to say, I mean, I think a lot of people, the thing that stops them about considering, going into business, whatever that looks like at any level, is that risk, like sleeping at night, thinking, you know what I mean?
Oh, yeah. I've had lots of sleepless nights. In fact, transparently, a lot more sleepless nights now than I used to.
Well, that's kind of where I want to get to here, because, and we'll get a little later into sort of specifically what kind of businesses you're getting into. But I mean, you're raising money primarily from other people, I would imagine.
Yeah.
And then having to make sure that goes as well as it can go.
Yeah. There's quite a bit of pressure, particularly when you raise money from friends and family.
Right.
And it's like, you bet on me, and I'm going to do whatever it takes to not let you down.
Well, let me back up for a second to, somebody like yourself who is obviously so driven. Before we cut on the mics here, we were talking about your children seem to be, chip off the block here, finishing college early and such. But you finish college at Lipscomb early, go into med school, and go into pediatrics. I imagine when you've done all this training and you're sort of going toward this career that's almost at the top of the heap, almost when you think of like effort put forward to go into this career, you think, well, I've got to use that for the rest of my life because otherwise I'm throwing it away, right? But I know many doctors who are in kind of my life stage in their 40s who are like, I think I kind of want to try something else. How have you reckoned with that?
It has been a reckoning, and just to be quite honest, there are sometimes I think, am I doing this right? Mm-hmm. Have I squandered the education, the six-figure commitment that I made to that education? And the answer is absolutely not, because it is my training as a physician is the underpinning of all of these different entrepreneurial and corporate ventures. And so what I've done is taken the base and then pivoted and built and pivoted and built. And I like to use the term 7 degrees of Kevin Bacon. I can get back to my core as a, quote, real doctor pretty easily.
Just a little diversion here for a moment, because public health has changed quite a bit, even in the few years since you've been out of it. But, any regrets not being in public health at this moment as a lot of question marks are around?
I wouldn't say it's regret. I would say I wish I saw more transparency and communication. If there's one thing that I learned from that very consequential and frankly difficult time, it was that transparency and communication and telling what you know and what you don't know is the most important. And I think public health today has become polarized into serving one voice or another, and it's lost that transparency. And I think that is to the detriment of patients and the public.
Yeah. Well, what do you make of all the changes coming down the pike from Washington related, I mean, specifically kind of in your lane with vaccine schedules for kids?
Yeah, there's a ton of federal policy coming out that I'm simultaneously excited and a little concerned about. That being one, another being rural funding. It's one that is very close and near and dear to my heart. But where's it going to go, and what's it going to go into? What kind of Medicaid changes are going to come? How is that going to impact our Tennessee population? There's a lot of things that I don't really know how to navigate. And I'm glad there are other people doing that right now.
If you're just joining us, I'm Blake Farmer. This is Nashville. We've got Dr. Lisa Piercey in the hot seat. For our profile interview, she's just written a book called Natural Born Entrepreneurs. She's a pediatrician, right? No, she's been working in the business realm since she left state government in 2022. So I do want to ask about how you decided you should become a doctor and a pediatrician specifically. Walk me through that.
Oh, yeah, that goes way back. And it's really not that exciting because I can't remember ever wanting to do anything else. I did know that I had a special kind of affinity for science and math.
Well, your parents were in farming, though, right? I mean, was this unexpected for you to kind of go off to be a professional?
I'm the first generation college graduate.
Really?
I am. And my parents were very supportive. They both went to some college but didn't finish. You couldn't tell that based on their level of success and intelligence. But they supported me, whatever I wanted to do. And I just always kind of was drawn to medicine. And I laugh because I'm remembering kind of an embarrassing story, but it's only the one I remember, which is when I was in high school. It's when George Clooney and ER came out.
Okay.
I may or may not have watched that with a stethoscope around my neck.
Oh my gosh!
It's so embarrassing, but it's what it reminded me of.
ER. Well, listen. If did you meet any George Clooney's along the way, though?
Unfortunately, not. I wish I had.
And you worked in. You worked in hospitals, though. When you were working for West Tennessee Healthcare, which runs the hospital in Jackson and several other satellite hospitals, right? You were not a practicing physician primarily in the hospital, right? You were an executive for the most part?
A little bit of both there
Okay.
for a while. And then I transitioned into full-time administration. And that's actually how that transition started. I never woke up one day and said, oh, I want to be out of clinical medicine. In fact, I still don't want to be out of clinical medicine. I've got patients scheduled 3 hours from now. I have never stopped seeing patients. I've just really reduced my schedule.
Yeah.
And
Why do you stick with it? Just to keep the license, or does it feed you somehow?
No, it's all about feeding me. I
Really?
couldn't care less about the license or the certification. It is wanting to continue touching the patients and affecting, hopefully positively, their situations, and B, frankly, it's a practical benefit for me to say, yeah, doc, I saw patients last week too, and I know what you're dealing with, and yeah, I've got to deal with those same troubles. So it kind of helps on the credibility side in what I'm doing now.
Well, how did you start specializing in child abuse? I mean, it seems like the kind of thing that probably few people are aiming to specialize in, and yet so important. What took you there?
The short answer is a mentor. I mean, you talk about something you don't wake up one day and say, oh, that sounds fun, because it is decidedly not fun. I was doing what every resident does, which is called a continuity clinic, which is where resident physicians, one afternoon a week, it's almost like their normal practice. The same patients come back. And one Wednesday afternoon, I came back from lunch and my mentor wasn't in the clinic and the lights were off. It was dark. She comes around the corner. She said, get in the car. We're going to go down to the Child Abuse Center this afternoon. I'm like, oh, okay, fine. And so I went down there, and that very first day, I saw 2 brothers who had been sexually abused by their uncle. I saw a 5-year-old who described to me how to make methamphetamine in a microwave. And I saw a baby that had had an immersion burn in the bathtub. And I distinctly remember going home and cooking dinner that night and sitting in front of my dinner plate and not being able to eat because I felt so nauseous. And the next Wednesday came around and she said, all right, we're going back down. And I said, no, ma'am, it's not me. And she said, get in the car. And, it was for my grade, so I had to. And over time, she taught me about how important it was for that level of service to serve people in their time of need. And over time, it just kind of became a spot of fulfillment for me. And it's a very unpalatable kind of thing. But when you look at the alternative of this might not get done if I don't provide this service, I can't stomach that.
Wow. And is that the kind of, is that what you still do?
It is.
That's what I thought.
It is, yeah. There are, at last I looked, there are 6 child abuse pediatricians in Tennessee. I still live in the West Tennessee area, and I'm the only one between Memphis and Nashville, and so I see child abuse patients typically on Friday afternoons.
That's it's heavy. I'm grateful that there are a few people who will do it. You were running hospitals in a region that has been one of the hardest places in America. It seems like, given the numbers, to run a hospital. What is it about rural Tennessee or just rural South that makes keeping a hospital going so challenging?
Oh, we talk about this all day.
Well, I know.
So, one of those things is just sheer demographics. There aren't as many people that live in rural areas now. And so at some basic level, every business, including healthcare, just needs volume. They need patients, they need clients. And so as you've seen people move to more urban areas, that's patients and providers. So another issue, other than just population demographics, is access to specialists. And,
You're saying the specialists all move to Nashville and Memphis.
They don't necessarily want to live somewhere where they can't, have a Whole Foods nearby or have a high-quality private school for their child. They want to go to a more urban area. That's just the trend nationally. So we have lack of access to specialists. And then all of the just the economics of it. People who live in rural areas are usually older. They're usually poorer. So the reimbursement rates and the payer sources aren't quite as lucrative as you get somewhere else.
Yeah. And yet, there's clearly some business opportunities there. Is that, were you drawn to that?
I think I was drawn more to trying to use the knowledge that I had accumulated in medicine, in business, in policy, and figure out how to provide sustainable rural health care, because those are my people. And I wanted to help my people in my area, because that's why I insist on maintaining my home in a rural area, because that's where I prefer to live. And so it's just as much a play on community and economic development and sustainability to invest in rural healthcare than it is just healthcare in general.
Well, we need to take a break. When we come back with Lisa Piercey, we'll get in the time machine, go back a few years to that era we all want to forget, the pandemic. So stay with us. This is Nashville.
Funding for This is Nashville comes from you, our listeners, and Music City Prep Clinic, Nashville-based provider for PrEP and offering comprehensive sexual health services in an environment designed to be safe, professional, and shame-free. Learn more at musiccityprep.org. Funding for This is Nashville comes from Burr & Foreman Law Firm, serving clients with transactional, litigation, and regulatory needs. Discovering how each client defines a win and working with them every step of the way to achieve it. Burr.com.
I'm Blake Farmer, and this is Nashville. We're joined by Dr. Lisa Piercey this hour, Tennessee's top doctor during the COVID pandemic. She's now moved out of public health and into healthcare entrepreneurship, but we're going to sit with COVID for a moment. Please stay with us. I know painful times for a lot of folks, and yet so consequential for us. Lisa Piercey, do you remember the moment you learned that the first case of COVID-19 was confirmed in Tennessee?
I do. I was driving around the Capitol.
Really? You're saying you were like in the parking lot of the Capitol and get a call?
I was in the parking lot, and the phone rang. I had just left the office, which was across the street, and was driving over to the Capitol to talk to the governor about what we thought was coming. And the chief medical officer called as I was pulling in my parking spot and said, "We've got our first positive."
Yeah. And was that, I was trying to remember what it felt like at the time for even me. And it's like, was it frightening, or was it just everybody knew it would happen at some point? Where were you that day?
Good question. I knew it was coming. We were not the first state. I don't remember which number, but there were states that had cases before us. And so as infectious diseases do, they spread. And so I knew it was coming. And I don't remember being scared or frightened. It was more of a, all right, buckle down, here we go.
Yeah. Did you expect it was buckle down, here we go, and it could be a while? Because thinking back, there were times in the early days where, for instance, when schools sort of closed, they're like, okay, we'll open next week. When did you realize it was going to be a long time before things were normal again?
I do recall the 2 weeks to flatten the curve.
Right, yes.
Which turned into 2 more weeks and 2 more weeks. But if you'll recall, and I don't remember the exact dates, it was about 8 to 12 weeks, and then there was a pretty big drop-off in May.
Yeah, that's right. That's right.
We started at the beginning of March. It kind of tailed off in mid to late May, which is a typical cycle of infectious disease. If you look at flu, influenza, or RSV season, you have 8, 12, 15 weeks of a peak.
Kind of makes the rounds one time.
Sure. And so it felt like, okay, here, that's good. Okay, we learned a lot. That was tough.
Did you think that it might be behind us?
I really did. I knew, as infectious diseases do, this will pop back up, but this has gone through once, and then the next time it'll just kind of become more routine. Well, I was wrong about that.
Wow. Well, listen, you could, I'm a little surprised you didn't write a book about that, but maybe it's the next one.
Like, nobody wants to read a book about that. I don't want to read a book about that, so no.
Well, do you remember your lowest point where, I don't know, you seem to be a very positive person and kind of the person in the room who's going to kind of cheerlead everybody, but where was your low point?
Thank you for recognizing that. I do feel like I'm a pretty optimistic person. When I think about the low point, I think about the people who suffered alone in nursing homes and hospitals.
Those were the early days, right, when it was totally shut off?
Yeah, because that was one of those things that but for the grace of God go I. I had elderly grandparents at the time, who were just typically in and out of the hospital like a lot of elderly people are. And I thought, what happens if she gets admitted and I can't see her?
And was it kind of on you or your department to decide whether people could go and see someone in a nursing home?
It wasn't. We got we got pinged for a lot of that stuff. It was our role to tell facilities, nursing homes, hospital, whoever, here's what we're dealing with, and you need to make your own decisions, but this is what we're seeing. And what we were seeing was not very encouraging.
Yeah. What did you learn about yourself that might have surprised you?
I learned that I couldn't say facts louder or meaner or clearer and get people's attention.
Yeah.
I ultimately learned, and I think you and I probably talked about this a few years ago, facts just sometimes don't change people's minds. And that was hard for me as a scientist, because that's the premise of science, is we're going to do an experiment, and here is the data, and here are the conditions under which we got those data, and this is the conclusion. Okay, I accept that.
What comes to mind, was this mask-related, vaccine-related, kind of shutdown-related?
The thing that comes to mind are all the crazy conspiracies.
Oh.
That when you just back up, you go, wait, nobody, who thinks that? I mean, all of the things that you just mentioned, vaccines, masks, whatever, shutdowns, there were valid points on both sides of that. And so it would be normal and expected for people to be confused or to say, I think about it this way, I think about it that way. But some of the crazy conspiracies, like they're going to implant a microchip when they do that swab up my nose. Like, no, where did you come up with that? And so that's what I remember being, I'm just going to hit my head against the wall.
Well, and at the time, we were, I guess, sort of taking the lead. A lot of stuff from the CDC, from Anthony Fauci and others. Did you feel like you were charged with making that message sink in with folks in Tennessee? Was that the primary job?
No, I think my primary job was to provide medical guidance and to say, in all of this environment, policy environment, the economic environment, social and political environment, I've got the patient at the center. And I am going to advocate for how do patients get the best care the quickest they can. And so if I can influence this policy decision, this funding decision, I want to do that. But always my charge, and I would submit for any physician, is the patient at the center.
Yeah. Well, you talked about having kind of your scientist hat on with a lot of this, and yet you're kind of having to compromise all the time because you've got folks who are saying, yeah, but there's also a cost to businesses. There's a cost to education. Did you find yourself having to even set aside some of that science, knowing, for instance, Tennessee was one of the states that opened a lot of schools sooner than others, and people said, don't do that. Were you having to, divide your brain or something at the time?
I think everybody in any situation, but particularly those in decision-making capacities during that time, had to learn to at least tolerate, if not simultaneously process, all kinds of information from every different angle, recognizing that there is no single source of truth. There is absolutely zero playbook or precedent for this, and we could both be right.
Wrong.
Or wrong. Well, I told you I'm an optimistic person. We could both be right.
If you're just joining us, I'm Blake Farmer. This is Nashville. I have Dr. Lisa Piercey, former health commissioner for the state of Tennessee, which is what we're talking about at this very moment. It was such a political time, and it seems like it's sort of stayed that way in the medical sphere, even as we talk about public health coming down from Washington at the moment. Are you a political person? Or was that new for you to have to navigate that?
That was totally new. And I commonly joke the governor tricked me. He did not. But that's our running joke because when I joined the cabinet at inauguration, which was in January of 2019, everybody forgets, including myself, there were 14 months that we worked together before the pandemic. And we did things that that Governor and I were mutually aligned on. Rural health, dental care for the uninsured. That was still at the peak of the opioid crisis. That is why I wanted to move into that position, not because I had any political leanings, but because I had been in clinical medicine. I had been in hospital administration. I was interested in policy, and I saw a governor who came in with a passion for rural issues, which aligned with mine. And I thought, yeah, this is a good opportunity to have a broader reach. And it was never in the plan to have the pandemic, and so that's the running joke with the governor is he tricked me into that.
You're saying because especially at the state level, it just is not usually a political role. Or even controversial.
Correct, and I think you said it in the intro. Most people could never name a health commissioner, and in fact, I probably couldn't have named a health commissioner, but not in this state or certainly not in any other states. But we all kind of know those people now because they were thrust into that role, whether they wanted to be or not. And can't remember the exact statistic, but I believe it was somewhere on the order of 38 out of the 50 state health officials turned over in the first year of the pandemic. Most of them because it's like, wait, I didn't sign up for this.
Yeah.
I'm a physician. I'm here to kind of advise on public health and, policy, but I'm not trying to get into this partisan mess.
Right, and you're taking this browbeating all the time, having to just talk to them about straightforward science, as you say, or it seems straightforward.
Just trying to be a doctor helping patients.
Well, I recall you talking at the time about maybe this very thing you were mentioning before about not being able to just say facts louder and people believe you. That you stopped at, I don't know, some corner store maybe near your home, and it suddenly hit you like, okay, this isn't working. Do you recall what this tale was?
I do. I was driving back to West Tennessee one Friday afternoon and stopped at a kind of a country grocery store that I knew had particularly good meat. And so I stopped in there, and on the door was a sign that says, masks are not allowed. This was in the peak of mask
That's right. It
season.
was mask related.
And the handwritten sign further went on to say, if you wear a mask in this store, we will consider you a threat and call law enforcement. And I thought, wow, first of all, I don't need meat that badly today, and I'll go somewhere else. But I thought when people get to that point, we're dealing with something other than a health issue here.
Yeah. Did you feel like you lost some credibility among what you would consider like your people, like your Gibson County people, your West Tennessee crowd?
I don't think so. The thing that I hear over and over, and occasionally still to this day, and it's heartwarming and appreciated, is, man, that was a tough time. I don't think you signed up for that, and thank you for sticking it out. And so I appreciate it when I hear that.
Yeah. What did you learn about communications?
Oh yeah, that's probably the biggest takeaway. Is transparency, humility, and frequency in communication. I mean, do you remember how uncertain and frightening those times were? And just any little nugget of information was just golden. And so I'm not saying communicate before you know what you're supposed to say, but just that frequent touch point. We do that in patient care too. That's why when your loved one is in surgery for 6 hours, they call you every hour, because it helps reduce the anxiety. Even if there's not much of an update, it's like, okay, things are staying steady, because when you don't know, your mind fills in those gaps, and your mind can go in some pretty scary places. And so frequency in communication, transparency, and I guess that's sort of related to humility as well, which is, here's what we know and here's what we don't know. And let me tell you, it might be different tomorrow. And the humility to say, this is what we thought yesterday, we've gotten some new information, and here's what we know today.
Do you think at the national level there was a lack of humility? I mean, I feel like you've seen Francis Collins kind of come out and say, if there's anything we did, we didn't make it clear how uncertain things were.
Yeah, and that's probably not what you want to hear from your doctor. If you just go in for a regular visit, you're like, well, I really don't know what's going on here. And so people want to look to physicians during a health crisis to get the answers. And in something this unprecedented, we didn't have the answers. And so there's a fine line between balancing the humility, but while maintaining the trust of, you can trust what I'm saying here.
Yeah. So much of public health revolves around trust, like you're saying. I mean, obviously, the new head of public health in Washington, RFK Jr., is undermining some of that trust in ways, whether you agree with him or not, it's sort of flipping some of what people had trusted in. Like on balance, do you see that kind of disruption that's happening at the moment as harmful, or is there something helpful that might be going on at this moment as people kind of question a lot more than we thought people had questions about?
Yeah, sure. I mean, there is no argument that there are things in medicine that we have assumed or just believed to be true, because that's what we've always heard for years and years and years. So I'm always an advocate for, now, hey, how did you come to that conclusion? And let's just make sure we're all working from the same data set here. So I think it's always good to challenge those long-held beliefs. However, I also think it's irresponsible to go out on a limb or just spout something off and then assume that it will become fact. I think that needs to be balanced with science. Science takes a long time. And newsflash, our society isn't willing to wait a long time anymore.
Mm-hmm. What has had you cringing in the last few months?
The information coming from non-clinicians. And I'm biased. I'm biased, but I think clinicians should be the one talking about clinical data.
Yeah. Do you see this in your own practice? I know you see some patients still. Maybe it wouldn't come up with them, but like, is it getting all the way down to patients in West Tennessee?
Oh, that's been happening for years, well before the pandemic, even with the advent of really the internet. When I was in general pediatrics practice, I remember mothers and parents printing out Medline and other things from WebMD, printing them out and bringing them into the office and essentially saying, some overtly, some not so overtly, I've made my diagnosis of my child. I just need you to write this prescription. And so when more information started coming to parents, that was a good thing, but it also started making clinicians and physicians' jobs more difficult of saying, yes, I understand you read that on the internet or on social media, but here's why it's not necessarily the case.
Yeah, but difficult to say that when it's maybe coming from someone who appears to be a health authority.
Sure, absolutely.
We need to squeeze in one more break. When we return, we'll explore the future of healthcare, Nashville's largest industry, and the role for medical doctors, MDs, in the healthcare business. Stay with us. This is Nashville.
Funding for This is Nashville comes from you, our listeners, and Music City Prep Clinic, Nashville-based provider for PrEP and offering comprehensive sexual health services in an environment designed to be safe, professional, and shame-free. Learn more at musiccityprep.org.
I'm Blake Farmer, and this is Nashville. The latest number from the Nashville Healthcare Council puts the impact of the healthcare industry locally at $72 billion annually, supporting 370,000 jobs. Of course, many of those are tied to the behemoth that sort of started it all in Nashville, HCA. But the Healthcare Council puts out this family tree each year that shows how companies are tied to each other. And one of the new additions on that family tree poster that they put out is Tristella, a firm that our guest this hour, Dr. Lisa Piercey, started. You don't say Tristella, do you?
Well, I say Tristella, but
then I think it should
tomato.
be.
A lot of people say it with a long I, and who am I to correct them?
Well, I guess I saw. Well, I guess I thought it was kind of tri-starry.
It is tri-starry.
But it's Tristella.
Thank you for picking up on that.
It wasn't that hard, but so I guess that's why I said tri, but it's Tristella. So full disclosure here, I only in the last few months came back to public radio after a couple of years in Nashville's healthcare industry, which was eye-opening. But I think people might be surprised to know that most healthcare companies in this town are not led by medical doctors. I wonder what you've found jumping into the healthcare business as an MD.
Oh, even before I got into the business side, it is very apparent that our medical education system writ large does not teach physicians about business. And, I'm on a university board, and I'm frequently asked, what should we do with our curriculum for pre-med students and whatnot? And I always say, business, AI, and business. And that's it's fine. Physicians don't have to know about business, but it's becoming more and more relevant. And you can do both. But you don't have to be a physician to be a good healthcare business person.
Oh, certainly, yeah. And I don't mean to suggest that you should. But do you find that people are sometimes not wanting to hear what the doctor in the room says because it doesn't align with the business strategy?
Oh, that is the age-old tension, which is doctor wants to do what's right for the patient. Business people want to do what's right for the business. And oftentimes the perception is that those things are not aligned. But I think more and more, and you have seen more clinicians, whether that's physicians, nurses, other physicians and other clinicians coming into the C-suite over the last 10 to 15 years because sometimes those things are at odds and you lose if you don't choose the patient. You might win economically in the short term, but you're going to lose long term.
What are you thinking of?
I think a lot of times private equity gets a bad rap in healthcare.
Yeah,
because,
talk about that.
Sure. It's just the classic charge that profits over people or profits over patients. And are there bad actors in that space? Sure. Every single industry under the sun has bad actors. But I think that's where some of that reputation started going down the wrong path, is that, they brought in, they being, for example, a private equity group buys a rural hospital, for example.
Yeah.
They bring in their typical PE playbook that they used in Boston or New York City or the Bay, and they try to apply it in Weakley County, Tennessee, for example. Not a real example, but that doesn't work. And so what happens is that they bleed the profits dry, they bleed the resources dry, and then they've left the community. Mm-hmm. And who suffers? The patients and the community at large, but the patient. And so when they're not putting the patient at the center and just looking at the profits, that's never going to work. Now, that also begs the question, is every rural patient care or just every patient care proposition in general profitable? No. Nothing in business is always profitable all the time. And so that's sort of been the charge of this new phase of my journey, which is let's talk about how we can balance what's right for the patient and also is profitable for the business.
So when you got going with Tristella, I think the idea was basically to go shopping, see what kind of business. Well,
I like to shop with other people's money.
But see what kind of businesses are out there. I understood it to be sort of like this sort of small to medium-sized businesses that might be doing something that you could help expand, grow, tweak up, and really get going. What did you find, and how does one even go on that kind of shopping excursion?
Sure. There's a book for that, and so we can talk about that in a minute. But what I set out to do was find a business, and it did start out with an intent to buy one, and it just ballooned from there. But to find one business that was doing it right, had the right bones, if you will, but needed a little help to professionalize, to mature, and to grow. Saying that a different way, I didn't want to buy a startup. I didn't want to buy a dumpster fire that I had to turn around. I wanted a good, profitable business. And then for me personally, there's a lot of businesses that meet that criteria. But for me personally, I wanted to do something where I could advance my own mission. And when we were talking earlier about that risk-reward proposition, there was also a missional component there, which is I want to be able to put my efforts forth on something that I care about. And I've mentioned several times, I care about rural health care. And so trying to find a business that's doing it well and that I can use this business to not only expand profits, but to expand community access to care, to expand patient availability to these kinds of services, and particularly bonus points if it overcomes some of the social drivers of health, which is how I've personally bought the businesses I have.
So what did that lead you to? Because it doesn't sound like it would lead you to this sort of brand new kind of tech-focused, AI-focused type of business, maybe something a little more practical? Where did you head?
Sure. If somebody had asked me on day one, are you looking for a specialty pharmacy? Are you looking in the wound care space? I'm like, no, I don't know anything about either one of those. But the opportunity came up, and I'm looking at sort of my criteria. And the book outlines what I believe very strongly that you should write your search thesis. What are you looking for?
And let me just say, the book, which we haven't mentioned in a bit, is a new book written by Dr. Lisa Piercey called Natural Born Entrepreneurs Breaking into Business Ownership, which, she's a couple years into it and already telling us how to do it, which tracks for someone who has been such a high achiever. But go on.
Thank you, Blake. I just had to write it down so I wouldn't forget how to do it the next time. But this business that I found, this first business, was in the wound care space. And you talk about wound care patients are often very sick. They're often lower socioeconomic status.
And wound care, I just sort of say this because I don't know that everybody understands what this is. We're not talking about gunshot wounds. We're talking about what? Like somebody with type 2 diabetes who their foot's not healing, that kind of thing, right?
That's right. So kind of the 2 or 3 classic wounds, diabetic foot ulcers, pressure wounds or bed sores in nursing homes.
Yes.
And then you've seen the people who kind of have weepy legs because their circulation is so bad. So those are the 3 biggest
and all
kinds.
related to chronic conditions that are prevalent.
All related to chronic conditions.
Yeah. Okay, go on.
And so those people that have wounds are often sicker, they're poorer, they're older. And this first pharmacy that I bought was using all generic antibiotics, mailing it all to their home. And so it overcame the barriers of affordability. We're going to do all generics, and we are going to do those as best we can covered under your insurance, mostly Medicare. And then secondly, we're going to get them to your home because we know what a big barrier transportation is. And so when I saw this profitable business that could clearly grow with a little, professionalization and processes, and it was serving an underserved population and overcoming some of those social drivers, I thought, man, this is it. And so we did that one. And then the second one was a senior independent living facility actually in Gibson County, where I saw the need of rural seniors. Adult children moved off. These patients were at home. They were fall risk. They were isolated. They were getting depressed, living in a safe and supportive independent community.
So you purchased one or you built one?
I purchased one.
Really? And it was not already owned by a larger organization?
This particular one had been, and they closed down during the pandemic, and so
it never reopened.
It never reopened, and so a partner and I bought it and reopened the business.
Yeah. Obviously, there are some people who go after buying businesses because they have some wealth that they need to use somehow. But I think that you're primarily getting investors involved. How hard is that to do? I mean, I think to some people that seems so like, I'm not in that circle. I don't even know where to start. What did you find?
Sure. And I want to address this misconception that a lot of people have is, oh, well, I don't have fill in the blank $1 million or whatever in the bank. Yeah, most people don't. I don't. I mean, that's not something, I'm not going out and putting my own money in these deals. Likewise, you see a lot of influencers and social media folks in this space saying, oh, anybody can do this, no money down. I'm like, oh, that's irresponsible. We're not going to go to that extreme either. And so personally, and in the investors and searchers that I like to work with, I want them to have a little skin in the game. It's got to hurt, and sometimes that hurt is I've got my own money in this deal. And as mentioned earlier, sometimes the hurt is I have asked investors, friends, and family for money to support this business, and I don't want to let them down.
If you're just tuning in, I'm Blake Farmer. This is Nashville. We're wrapping up our time with Dr. Lisa Piercey, who has, was the state's Tennessee's top doctor during the pandemic, now squarely in the business world, and even helping other people do it with her new book, Natural Born Entrepreneurs, Breaking into Business Ownership. How much of this buying businesses was sort of like, listen, I don't have time to grow something from scratch?
It wasn't so much that I didn't have the time. I didn't have the capacity where I was in my life. So I came out of state government in my mid-40s. I had 4 children that were in high school, moving into college. And, just like most professionals in their mid-40s, I had a mortgage. I've got a lifestyle. I've got, and I didn't want to start from scratch and have 2 or 3 years of pretty hard times and scarcity with a risk of 70 or 80% failure. And that just wasn't something that I could undertake. And that's the premise of the book, which is if you are a mid-career professional and you want to go do something on your own, it doesn't have to be a startup. There's a different way to entrepreneurship other than just starting a business.
And from the sound of it, the businesses that you all have taken on are not businesses you would have started.
No. I didn't know anything about those kinds of businesses when I got into it. But when you look at the framework of what makes for a strong business and what makes for both a community and a patient impact, that's the lens through which I look.
How much of your work as you're sort of starting out fresh, did it matter that you were in Nashville where there, I think for people who are not in the healthcare business, you almost don't see just how much, I don't know if the right word's infrastructure, but just like people, players, investors, people who used to work at big companies, it was all there. How much of that has kind of assisted you in getting into what you're doing now?
I absolutely would not be where I am without the healthcare infrastructure and people in Nashville. And I didn't, because I've always been here, this is where I've trained, I didn't realize that every city didn't have that.
Yeah.
And one of the businesses I bought is in Mississippi, in one of the metro areas in Mississippi. Another one is in a metro area in Colorado. And so, as a good business owner does, I try to get plugged into those communities. And I have not found anywhere near the level of support and peers that I have in Nashville, and can't imagine being anywhere else.
And what is it that, can you put your finger on the thing that is out there that is so helpful? Is it connections? Is it experience? Is it something else?
100% it is every conversation that you have, whether it is with an investor, an operator, whomever. How can I help you get better?
Is that just because people are nice, or that it's just like it's collaborative because it could be good for them?
I think it kind of goes back to the family tree, because we're all interrelated. And whether it is
the Healthcare Council's family tree.
That's correct. And so whether the healthcare businesses themselves are directly related, you're going to run into those same people, and you're going to need something in their vertical one day. And so that it's just that spirit of collaboration and mutual growth.
Dr. Lisa Piercey, former health commissioner of Tennessee, turned healthcare entrepreneur and investor. Thank you so much for joining us.
Thanks for having me.
And thank you for tuning in this hour. This is Nashville's a production of Nashville Public Radio. Our board operators, Liv Lombardi. Our managing editors, Tasha A.F. Limley. The masterminds behind that theme music you hear are LaRange and Namir Blade. You can listen back to any episode at thisisnashville.org or wherever you get good podcasts. You can also just ask a smart speaker to play the latest episode. And the conversation doesn't have to end right here. You can comment or tell us what you want to hear on the show. Just leave us a message at 615-751-2500 or talk to us on the socials at This Is Nashville. This is Nashville. I'm Blake Farmer. Go in peace.